Welcome to Dynamo Lunch Radio. We are back in the studio with Janice, and my special guest today is Dr. Idelle Brandt. She's my holistic dentist. We crossed paths quite a few years ago, and Idelle has been my go-to dentist for my various ailments, be it my TMJ or trying to save a tooth from a root canal, because when I grew up, I loved my candy, and I have had 6 mercury fillings in my teeth for quite some time that I had taken out. And now Idelle has been my dentist for the last few years, and I truly recommend her. And I'm so thrilled, Idelle, that you took your time to come to the show. Thank you very much, and welcome to the show.
Well, thank you, Rika. It's a pleasure to be here.
Right. Now, Idelle, just a quick question. What made you decide to become a dentist?
Well, that's a great question. When I was a kid growing up, I always wanted to help people. I had a lot of sick people around me, and I thought about going to medical school, but then I decided I wanted something a little more lighthearted, and I was a very creative person, being that I had, that in college I was a chemistry major. I liked to play in the lab and be creative, and I loved to cook and bake and make creative recipes, and I just wanted to do something a little more lighthearted and still help people and be creative, and dentistry seemed like the perfect field for me to go into.
Oh, I have to smile when you say something lighthearted, because myself and quite a few people who I meet, everybody has a dentist horror story. And it took me a long time to find, in a way, the thought of going to the dentist not a nerve-wracking experience, because I've had quite a lot of those when I grew up in South Africa. Now, Idelle, you are not just a dentist, you're a holistic dentist. What is the difference?
Well, I have been a dentist for over 30 years, and the last 10 years or so, my practice has been directed at being a holistic dentist. And what holistic dentists try to do, or do, is they try to do dentistry in a more biocompatible way. What that means is doing fillings that are less toxic than the conventional mercury silver fillings, using products that are just kinder to the body and do not create adverse reactions in people.
So that also, besides fillings, what else do you do in your practice? Because I know there are many aspects to your practice regarding dentistry.
Yes, there are. I'm also a nutritionist. I'm a certified nutritionist counselor, and that is really, to me, really important, because when I was in college, I thought at one point I would go for a graduate degree in nutrition, because I really love that field. I find it fascinating. I love, as I said, playing with food and creating fun, healthy recipes. And even back in the 60s, I was making my own yogurt and whole wheat breads, if you can imagine. So, it's been a passion for me. And so having a certification in it certainly gives me more validation for that. And I integrate that part of holistic health into the practice. I help people to get on a better path of eating properly for detoxification and rebuilding their health. Other things that I do also, I'm a Reiki Master teacher. So I'm well versed in many modalities of energy healing. I'm not just certified in Reiki, but in other types as well. So like when you come to my practice, one of the things that every patient gets is a 2-minute tune-up, which balances their energy field. It takes 2 minutes. It's very relaxing. It's therapeutic. And for some people, actually, it's quite life-changing. And it's an easy thing that people can relate to, because they can actually see the tuning forks, unlike some energy modalities where everything is invisible. And they can actually hear the tuning forks. So it makes it more real for them. So that would be another aspect of, of alternative modalities that I integrate into my practice. I also am a hypnotherapist. I'm certified in that as well. And I use that quite extensively for people who are phobic and patients that have anxiety in the dental chair. So we get them to be more relaxed and feel at ease with us.
Thank you, Idelle, because there's one thing when I come to your practice. I still have the little anxiety because of my history, but it has gotten a lot better because, we get on and I trust you. We have a great time no matter what's going on with my teeth at that time, and hopefully not too much. In any case, when I walk into your practice, I find it's very calming.
Well, thank you.
You know, absolutely. And the front desk right away, it makes you feel very welcome, which totally takes the edge off the regular dentist visit. And I don't smell the dentistry smell, the old clove smell. And it's just right from the beginning, walking in there, you just feel you're in a safer place. And I also know that with your nutrition work, you really have a much more whole body health approach towards dentistry. So when you look at the teeth or look at the gums or the cavities, because of your training and knowledge, you are able to give so much advice that is very helpful, that is very preventive for dental issues coming up.
Yes, I do that as best I can because I am very knowledgeable in many alternative fields and how to integrate them into conventional medicine.
Now, in order to give nutritional advice, you had said that you became certified. So if you are a practicing dentist, are you able in New York State to give nutritional advice as a dentist?
Being that I'm a certified nutritional consultant, yes, I can.
Right, but if you were not?
I guess you could give advice, but I don't know if it's legal. If you give the wrong advice, you might be in trouble. You know, as a health practitioner, you want to be careful what you do tell your patients, because if you say the wrong thing and they have an adverse reaction, that is not a good thing for you.
Right. So because of your interest also and knowledge, you decided to get certified in nutrition, and now it's a no-brainer for you to integrate the two.
Yeah, and the thing is, I mean, I lived in nutrition. I mean, everything I tell my patients are things that I've done for myself, whether it's doing green juicing or smoothies with superfoods in them, or just taking nutritional supplements that will help them to detox and be stronger, healthier, and rebuild their body.
Yeah, because looking at the dentists such as Weston A. Price or reading the work of Royal Lee, a lot of dentists were also nutritionists.
Yeah, well, us dentists tend to be very creative people, and we like to integrate more than one modality into our business of dentistry. Right,
because what I find so interesting is how nutrition, well, your teeth can reflect your nutrition.
Absolutely. If you are mineral deficient on any level, your teeth will start demineralizing and you will start to get more cavities, or your teeth may start to look very ghosty and see-throughy. So it's important to make sure that your minerals are at a good level. We can also tell that by looking at your tongue in Chinese medicine. We can read your tongue. That's another technique that I use in helping people to heal. The mouth is really a window to the rest of your body, and if you can get your mouth healthy, usually everything else starts to fall into place. It is just a reflection of everything going on in all of you. And most of us know that already, especially in terms of periodontal disease. I mean, it's been through all the media that if you have periodontal disease, it is a marker for heart attacks and strokes and other chronic illnesses that are usually not so good. So if you have that periodontal disease, you definitely want to get that under control so the rest of your body can start healing.
It's very interesting that you mentioned all that, because last night I went to a seminar regarding thermography and breast cancer. And the lady who was giving the seminar said that she hadn't seen one thermogram that had not shown a level of inflammation in the mouth area. And that to me was very, very interesting, because that is a whole nother topic, thermography. But the heat showing up, and heat is inflammation. Yes. And you're just saying periodontal disease and heart disease, these are all inflammatory situations we're talking about. So the mouth can really hold a lot of, or can be the source of a lot of inflammatory processes that can migrate into other parts of the body.
Yes, that is very true. And that just reminds me of another thing. When you come to my practice, we also take your saliva pH, which is a really important marker for the health of your entire body. If your saliva pH, which will determine your alkalinity or acidity in your body, if it's low, meaning that you are acidic, that's usually a good marker that you have inflammation in other parts of your body, whether it's arthritis or something similar to it, or inflammatory disease, as you said, in the breast or elsewhere.
Mm-hmm. And also, when I come to your practice, besides going through the tongue exam and doing the saliva test, I also have my blood pressure taken.
Yes, that is very important because a lot of people are walking around and they have blood pressure issues and they're not even aware of it. A lot of people don't even go to the medical doctor often or once a year even, but they do go to the dentist at least once a year and preferably twice a year. So it's important for the dentist to be part of that holistic team in evaluating patients' health, not just for their mouth and their teeth and their gums, but for whole body wellness.
Mm-hmm. Now, Idelle, when you look at the teeth, and this is what I really like, is the fact that when I come to you, you clean my teeth.
Yes.
You do the checkup. You do everything that is involved around my teeth. And I really like that because when I grew up in South Africa, my dentist cleaned my teeth. To me, it was a new thing that there's a dental hygienist doing the cleaning and the dentist does the checkup, but you do everything.
Yes, I do everything. I like to really know my patients and their health concerns, and I find that when I do that, the cleaning with them, I get more information about their health and can address them as well.
Mm-hmm. What are the most common teeth or gum complaints that you see in your practice?
Usually bleeding gums is number one, I would say, or just general achiness in their teeth, or people feel like they have a breath issue as well. We do a lot of that. If people have chronic bad breath, we can help them. It's a long list that really varies with the person.
It varies with the person. And the question is, do you have some patients who come to you because they've heard about you and they've heard that you are the go-to person for mercury removal when you have silver fillings?
Yes, we do have people who come specifically just to have their mercury fillings removed in a safe manner, which is what we do in our practice.
Right. And the age group of your patients in your practice?
It varies. We have from as young as 3 to as old as 90. 90.
And I know that also from your website that you are also specialized in, I think it's called geriatric dentistry?
Well, I wouldn't call it specialized. I have extensive knowledge of that because I did work with a geriatric center for about 8 years. So I'm well versed in the challenges of the geriatric population.
So you just go all around.
Yes.
The whole thing is, I had braces, I had 6 amalgams, I had them removed, and I know you saved me from having a crown. But speaking about amalgams, in our next segment, listeners, we are going to go and talk exclusively about the silver fillings, which is really a fancy name for amalgam fillings. And Dr. Idelle Brunt is going to give us all the information that we need to know. Talk to you soon.
Talking Alternative Radio, 24 hours a day.
Are you confused about which diet is right for you? Are you tired of being tired? How about improving your energy, strength, and appearance? Hi, I'm Rika Keck, a holistic nutrition and wellness consultant. If you have answered yes to any of my questions, contact me now at nyintegratedhealth.com or at 646-285-8588. Initiate change and transform your life.
Are you concerned about the future of your business or career? Would you like it all to just be better? Well, the way to do that is through better communication. And the best way to do that is training from the team at Improving Communications. This is Larry Sharp, host of the Ivory Tower Radio program and director at Improving Communications. Does your office need better leadership, customer service, sales, or maybe better writing or speaking skills? Could they be better at dealing with confrontation, conflicts, and touchy subjects? All are covered here at Improving Communications. If you're in the New York City area, stop by one of our public classes or get your human resources in touch with us. The website is improvingcommunications.com. That's improvingcommunications.com. Improve your professional environment. Be more effective. Be happier and make more money. Improving Communications. That's the answer.
Hey, all you crazy listeners. Looking to boost your business? Why not advertise on Talking Alternative with very reasonable rates? Interested? Simply email at info@talkingalternative.com. Talking Alternative.
Welcome back to Dynamo Lunch Radio. We are back in the studio. Dr. Idelle Brandt is with me, and we are talking about holistic dentistry. And Dr. Idelle Brandt, first, can you give our listeners your contact information, please?
Sure. My website is thebrandwellnesscenter.com. thebrandwellnesscenter.com. That would be our website. If you need to contact us by telephone, we're in New York City in Manhattan. It's 212-947-0073. That's 212-947-0073.
And your address?
We're at 19 West 34th Street. We're on the 10th floor. And we're right there in Midtown Manhattan, right opposite the Empire State Building.
Thank you very much, Idelle. Now, if a patient comes in and says, Dr. Brandt, I've heard about the mercury and I don't feel comfortable with it, and I've decided now that I want to do something about it. Can you walk us through the process that a patient will go through?
Yes. When a person comes in and they say they want to have their mercury fillings replaced, we usually go through their medical history and we ask them why they want to have it replaced. We cannot tell people that the mercury fillings are poisonous and toxic, and no one will actually say that. All we can say is that mercury is toxic and is poisonous, and it's in all the fillings. It's in at least 50% of the fillings. Just as a side note, mercury is the second most toxic substance on the planet. The first most toxic substance on the planet is plutonium, which is radioactive, and obviously we do not use that in your fillings. But the mercury is used in your fillings, and it's been used in these mercury silver fillings for almost 200 years. And, there is a better way. I mean, there is progress. So we just try to inform them of what the story is with the mercury and let them make that decision. Some people come in, they already have high mercury levels. They have some chronic illnesses. They've been to medical doctors. They've been checked out, and they've been told that they have heavy metal toxicity, mercury included. It could be lead, it could be arsenic, it could be other metals as well. But the mercury is the main thing that concerns them, because some of these heavy metals you have no control over. You don't know where they're coming from. But, we want to get rid of the ones we do have control over. And the mercury fillings are certainly ones we can remove from your body and replace with something less harmful. So when they have the mercury fillings removed, there is an entire safety protocol that we do use in the office. And it's really important for anybody listening not to just go out to their dentist and say, hey, I want my mercury fillings replaced because I know these things are bad for me. You have to, use a little discretion and discernment and make sure that you're going to a dentist that is well versed in safety precautions and protocol so that you do not get sicker when these mercury fillings are drilled out. And when fillings are drilled out, that the stuff that's being drilled out is going to go flying everywhere. The vapors are going everywhere. The particles are going everywhere. So you don't want to swallow this. You don't want to breathe this. You want to be protected. So in our office, what we do is we give, number one, we make sure everybody has a separate oxygen supply to breathe during the visit, which is a very comfortable thing. And the other thing that's very important is to have some sort of rubber dam or protective device in your mouth that is keeping you from swallowing the pieces and the little particles that are coming out. What we also do in our office is we have our patients rinse with activated charcoal. This will coat your soft tissues of your mouth so that if anything should get past the protective device, at least you know that your mucosa of your mouth and your gums are protected and you're not absorbing this mercury vapor that's coming out. We also cover you from head to toe, from your hair down to your, mid-calf with some protective things that will keep the vapors from being absorbed through your skin. We also have 3 suction devices, 2 of them which are in your mouth and 1 of them which lays on your chest. It's a very noisy, high-speed, evacuation system that removes whatever vapors are coming out. We also have an ionizer going on in the room. The ionizer is very important because what it does is it keeps the room clean from all the particles that may be flying around. And on top of all that, we ourselves, the dentist and the assistant, have our own protective devices. We don't want to be breathing this stuff either. So we have some special hazardous masks or biosafety hazard masks that filter out mercury particles as well as mercury vapor, and we wear that during the procedure.
Wow, that sounds like it's a whole hazmat operation going on.
Yeah,
you know?
if you go to our website and go to the page on mercury fillings, there is a picture of me and the assistant working on somebody, and you look at that, it sort of really looks quite scary and intimidating, but you should know that you are really fully protected during that procedure, and you will not get sicker from removing the mercury fillings because you have been thoroughly protected.
Mm-hmm. Because when you do have these silver fillings or mercury fillings in your mouth and you chew, there are vapors going up all the time into your brain. Isn't that so?
Yes, that's quite true. There are some links on our website to some videos that are quite informative and interesting to watch. And yes, as you chew on these mercury fillings, the mercury vapor is coming out. When you drink hot liquids such as coffee or tea, certainly the body temperature is going up and more mercury vapors are coming out. So just by living, breathing, eating, you are exposing yourself to quite a bit of dose of mercury toxicity. And even if you did nothing and just lived without eating, if that were possible, and I know it can be for some people, but if it were possible, you would still be inhaling the mercury vapor coming out from these fillings.
Mm-hmm. It always amazes me how mercury has been used, because when I did see photographs of mercury fillings in teeth, the teeth also are more predisposed to cracking with the mercury because of the expansion of the mercury.
Yeah, because it is a metal base, what's in there. It's mercury with some other metals. And as you know, when you heat metal, and if you make metal colder, it will expand and contract. And when it's doing that outside of your mouth, it's one thing. But if it's in your tooth, it will expand and contract within the tooth. And it's not unusual for pieces of teeth to just sort of crack off after you've had a mercury filling in there for some years.
Yeah, that has been my experience. And as I say, I have some quite deep craters in my teeth. And thanks to your good care, they have been very quiet. Touch wood here in the studio. Now, Idelle, if someone comes to you with, say, 3 or 4 fillings, silver fillings, would you choose to do one silver filling at a time, or what would you recommend?
Okay, it really varies with the patients coming in. And now, if you have some chronic health issues, I would certainly only do one filling at a time. If you're a relatively healthy person and you sort of want to get this thing out as quick as possible, we can do 2, possibly 3, depending on how large the fillings are, but certainly not more than 3 at a time. I think that's more than enough for anybody to deal with.
Mm-hmm. Because then, once you take out the silver filling, what do you replace it with?
Okay, that's a great question. Obviously we're not going to replace it with anything that's metal. We usually replace it with composite fillings, which are white fillings, or we replace it with a porcelain, like a bonded filling of bonded onlay or a crown. If they're very large, the fillings, sometimes they need crowns.
Mm-hmm. Because this morning when I was reading in anticipation of the show, I was reading how also some people have crowns, but underneath the crown is a tooth that has a silver filling. And that can create a lot of issues within the mouth regarding the electricity and the brain, and because there's so much electricity going on in the body to begin with.
Yes, there is such an effect called the Galvanic Effect, which occurs between different metals. And having a mercury silver metal filling underneath a metal crown of some type, and most crowns have a metal base. They may look like porcelain and white on top, but if you look around the edges, you may see some darkness, and that usually is the metal base under the crown. So when you have these metal crowns touching these mercury fillings, there is a galvanic reaction that could really be quite uncomfortable, painful, and create all kind of havoc in your body. As many of us know, the teeth are on meridians, according to Chinese medicine, with other organs and body parts. And I have found quite often that when we remove the metal fillings, the mercury fillings, as well as the metal crowns, that people's symptoms that were associated with those teeth from special organs within their body, those symptoms tend to go away. The classic one I could think of, it was a young woman who came in who had reflux for many years, and one of the her teeth had mercury fillings. It was on a premolar, and when we removed the metal filling and replaced it with something less toxic, she called me up actually 2 days later, and she said she couldn't believe it, that her reflux was totally gone after 10 years. She didn't have one iota of it left.
Oh, that is a great story. And that's the thing. You had touched on it, how the meridians and teeth, how they correspond to organs and glands. And that is the thing that I always look at. Say, if I have a tooth and it's acting up, I think, is there an issue with the tooth? Or is there an issue with the organ or gland that is corresponding with the tooth? And that's when you have to dig deeper and get the information and see, and maybe work at gland or an organ level. It might just be the tooth, but it might be another issue. So then going after the tooth without addressing really the core, the root of the issue, can keep you with a problem.
That can definitely happen, and I see that quite often. Many people have had these pains in their teeth, and dentists couldn't figure it out, and then of course they go and get a root canal thinking that will solve everything, but unfortunately the pain persists, and it's mostly because there's an underlying systemic issue that hasn't been addressed yet.
Mm-hmm. Root canals are a whole another story, for sure. I know we will touch upon it on our next segment, but just briefly, while we still have 1 minute left, I think, can you just let us know, what do you do in your practice to protect the patient from x-rays?
Oh, that's really another excellent question. What we do, the patients wear a lead vest with a thyroid protector as well.
So the thyroid is protected during the radiation?
Absolutely. That is absolutely critical. And we also give them a homeopathic remedy for x-rays as well as an antioxidant vitamin C to stir up their immune system.
That is tremendous. I mean, x-rays are very controversial. Dr. Brandt knows that I don't do the x-rays. I've signed the releases. I just don't feel comfortable with it. And I don't have a great mouth with healthy teeth, not at all. But again, it's working nutritionally, working mind, body. I mean, there's a lot that we can do from a nutritional perspective to support our teeth, and our teeth will respond when we do that. And now, Dr. Brandt, I always call you Dr. Brandt or Idelle, I'm sorry, either way. With regards to the x-rays, what type of x-rays do you use in a nutshell?
That's also another point I wanted to mention. We do use digital x-rays, so there is about a 90% reduction in radiation. So as I jokingly say to the patients, you don't have to worry about leaving here glowing in the dark because the radiation levels are just so low. And between that and all the protection, you fully are covered well.
Well, and then we tune you up before you leave, right?
Yes, and then we give you a nice tune-up on the road out.
Thank you very much. Listeners, we will be back just after this commercial break.
You're listening to the Talking Alternative Network.
Are you suffering from aches and pains? Has traditional medicine let you down? Are you tired of taking toxic medications? Then come to the Double Diamond Wellness Center and learn how our natural methods can help you to heal. Call us now at 212-721-8183. That's 212-721-8183. Or find us on the web at www.doublediamondwellness.com. We look forward to serving you.
Hi, I'm Austin Marola.
And I'm Sloan Wainwright.
We're the hosts of the new Thursday morning show, The Music
Power Hour.
At 11 a.m.
We're going to have fun.
And shine the light on all aspects of music.
And its limitless healing possibilities.
We're going to invite artists to share their songs and play live.
We'll be listening and talking about great music from yesterday to today.
So you're invited to share in our musical conversation.
Your ears will be delighted with the sound of music.
And our voices. Join Austin
and Sloan
live Thursdays at 11 a.m. on TalkingAlternative.com.
You're listening to the Talking Alternative Network.
Welcome back to Dynamo Lunch Radio. The dentist is in the house, and I am just feeling my teeth, all of them that are still here. Now, we were talking about root canals just before we headed to the break. And Dr. Idelle Brandt, what could you tell us to be aware of regarding root canals?
Well, you want to avoid them as much as you can because root canals become a breeding ground for biofilms and residual infections. And
what are biofilms?
Biofilms are sort of like a plaquey residue that the bacteria live in, and they just stay in the tooth, on the tooth, within the tooth, around the tooth, and they create infections, residual infections in the tooth. So even if you have a root canal, you may still have a problem. It doesn't necessarily mean that the tooth is healed per se. Mm-hmm. So what we do in our practice, we've had many patients who said they need root canals because they've been told by other dentists that they do. But there are many ways to address that without having a root canal. Sometimes it may be inevitable if you want to keep the tooth in your mouth, even if the tooth is really, really gone and dead. You may need that root canal if you want to restore it. However, that being said, if there is a possibility of a chance that the tooth is mildly vital on any level, and we can tell that by the x-ray and by cleaning out the tooth, we have ways to revitalize the tooth and have it repair itself.
That is great, because what happened to me is I didn't know about all this holistic dentistry. I wasn't in the health field at that time, but I went to the dentist because I had an achy tooth, and they said, there's nothing wrong with your teeth. We can't see anything. And then 6 months later, I went back. I said, that tooth is still hurting me. And then they said, you know what? There is a problem with your tooth, and we want you to see a root canal specialist. I said, wait a minute. I was just here 6 months ago, and you said there's no problem. Now we're talking root canal. That is when I really switched gears, and I investigated holistic dentistry. And to this day, I have my tooth, and it has all its roots intact. Thank goodness. Touch wood again.
That's great. Yeah, that's a terrific story, and a cautionary tale for everybody to be aware of, that just because a tooth hurts doesn't mean it needs a root canal. Especially, I've seen a lot with people with teeth on the top part of their jawbone and the maxilla. A lot of those teeth, they're in the sinuses, and the sinuses can be infected, and that may make the teeth feel like they're hurting. And if you go to a dentist, they'll just say, oh yeah, you need a root canal, but even after you have that root canal, the tooth will continue to hurt because the sinus is infected, causing the pain in the tooth, not the tooth itself causing the pain.
Right. Now, for a root canal, there are different ways in conventional dentistry versus, I think, holistic dentistry or biological dentistry with regards to what the materials that are being used. Am I correct on that?
There are different materials. We do work with a holistic root canal specialist, and he uses the special materials that are more biocompatible. But the issue with the root canals for most people is not so much even the biocompatibility, it's more of the residual infection that is left behind. The canals of most teeth have more canals than what are seen on the x-rays, and sometimes they are not thoroughly cleaned out, and therefore you get a residual infection in those little accessory canals that are never really addressed.
And speaking about biofilms, because I imagine it to be like a colony with, be it bacteria or bugs and critters, but now they're in a little shell. Now, if you use antibiotics because there's an infection, the antibiotics, or if you take antimicrobials in holistic medicine, they don't go through that shell, so they don't address the bacterial infection.
That is quite true. So, root canals can have lasting problems with them. And what I see also with other people is people have had root canals for 10, 20 years. They've been fine, no problems, and all of a sudden, these teeth are starting to act up. And a lot of that has to do with your own immune system. When you had the root canal, you might have been younger, stronger, more vital. Your immune system was stronger because you were younger. And now as you age and, your immune system is getting weaker, then it's not able to maintain the integrity and the health of that tooth because the biofilm is starting to win.
Mm-hmm. And like you said, the infection can be there. It's hidden. The immune system can't see it, so to speak. If you take antibiotic or antimicrobials, they won't get there. So at the end, you can have an infected tooth. But you can also have an infection that is silent, that you don't know is going on.
Yes,
right?
That can happen as well.
And at the same time, it is creating problems in your body, in other areas in your body,
That's right, because those teeth are on meridians with other parts of your body. And we see that quite often as well. And then at that point, you may have to get the tooth out.
Right. What I just think is really important to know, number one, that, and this is what we do in our work, is to consider the health of the teeth, what's going on when somebody presents us with health conditions or health situations and pains.
Yes. And, that being said, I should just mention that I have seen many people that believed that, extracting the root canal tooth would solve all their health issues. And I have seen time and again that doesn't always work. You really need to rebuild your immune system. You need to detox the body as a whole. Taking out root canal teeth is part of the solution, but it is not the entire solution. You have to be a little more broad-minded and realize that your whole body is connected, and there are other aspects to healing.
That is wonderful information and very helpful for our listeners out there and myself too. As I said, I stayed away from the root canal, but again, I will live on the planet and I hope to keep all my teeth. But root canals have always been a focus of the Western Enterprise Foundation as well. And just, you mentioned you have to keep your whole healthy immune system strong to really support any infection that could be going on in your body.
Yes.
Now, speaking about root canals, we had spoken about mercury before. We'd spoken about x-rays before. These are all stressors on the body, and I know that your office is mercury-free. And I know that your office is also BPA-free. We'll talk about that later. But what are your thoughts regarding fluoride?
Fluoride is really a big topic. Yes, we're in New York City and our water is fluoridated. And fluoride has many effects on the body. I think the biggest effect it has on the body is affecting all the iodine receptors in the body. Iodine receptors are located in the thyroid, they're located in the breast, they're located in the ovaries and the prostate. So if you have any issues in these organs in particular, you might seriously think about that you might have a fluoride overdose and preventing these iodine receptors from picking up the iodine, because now the iodine receptors are picking up the fluoride. If anybody remembers from their high school chemistry, fluoride and iodine and bromine and chlorine, they're all in the same column on the periodic table. So the electron configuration in that outer shell for each of these elements is identical. And the iodine receptors do not see much of a difference in them. It just sees that outside electron shell and grabs whatever you have the most of. And for us people who live in fluoridated areas, fluoride would be number one. The other issue that's really concerning is bromine, because that's found in everything. It's in fire retardant clothing. It's in all plastics. It's in that new car smell. It's in baked goods. It's in some drinks like Mountain Dew. It's in a lot of foods, and you got to be aware because it's messing up people's iodine receptors, and thyroid issues are definitely on the rise, and polycystic ovary disease is on the rise, cystic breast disease is on the rise, and they have found that the issue is with these iodine receptors that are being messed up with these other halogens that are being accepted by them.
And that's what I also say is we have a double whammy going on because our water here in New York City, we have the chlorine and we have the fluoride.
Yes.
So two of them together.
Yeah, the thing with the water system in New York is that you have to remember fluorine in particular is the only thing they add to the water it's a drugs per se, and it's given to everybody regardless of their weight. And most drugs are given to people depending on how much they weigh. So you're getting a tremendous overdose because you're drinking this stuff, you're eating food that's being made with it, you're in the shower. You're in the shower, you're absorbing it, it's in all the baked goods, everything that you can think of that's made with this. So there's been a lot of controversy. They're trying to get the fluorine out of the water because of that, because people are being overdosed, and the fluoride has other effects. The pineal gland in your brain, which is the big organ that that's not a big organ, but it's the main organ that puts out the melatonin. Mm-hmm. And what the fluorine does is it calcifies it. And certainly if you calcify your pineal gland, you're not going to be sleeping well because your melatonin's not going to be being produced well.
Mm-hmm. Now, with regards to that, we have the chloride in the water, we have have chlorine, we have the fluoride in the water, we have a lack of iodine because it's not in the topsoil anymore. So there are many minerals that we are missing, and we have too much toxins coming into the body. Regarding fluoride and your practice in dentistry, what do you see in patients?
Well, we do see some patients who have they have fluorosis of the teeth, which means they have a lot of discoloration of their teeth because they grew up in areas where there was a tremendous amount of fluoride. And that's not something that's easily corrected. The teeth look very discolored. They have white and gray marks on them. And really the only way to correct that is with some sort of cosmetic makeover.
Oh, so like a veneer type?
Like a veneer
Wow.
or crowning. And it's really, it's an expensive procedure. Nobody wants to go through that if you don't need to. It's certainly not a holistic procedure. But if your teeth are very unsightly, you may have to get that done.
Yeah. Wow, that is incredible news and great information for us to know about. Now, Dr. Brandt, speaking about teeth and speaking about the fluoride, there are toothpaste out there, and it's not that easy to find toothpaste that do not include fluoride. I really look carefully for them. I do find them. They are on the shelves. And what would you like our listeners to know?
Well, if it's not food, don't use it in your mouth, okay? If you look at any toothpaste, it usually has the cross bones with the skull on it. At least they used to. They may have taken it off. But it does have a poison control contact there because most toothpaste are poison. Certainly if you have little children that are brushing their teeth with these toothpaste because they taste so sweet and delicious, they may be eating it. And certainly little children can be poisoned with the toothpaste. So you don't want to be using that with little kids, especially the fluoride, which is a known neurotoxin as well. So I'd say in general, you want to look for toothpaste that have a list of ingredients that you can actually pronounce, and might even look like some sort of herbs or essential oils or even a food base. A nice thing to do at home is to brush your teeth with baking soda. Doesn't taste too great, but it does the job. You can even do something like oil pulling with coconut oil, which is food, and it does help the teeth remineralize as well as help gum disease.
Mm-hmm. I'm so glad you mentioned the baking soda because I was going to bring it up because I know that is used for brushing teeth and also keeps them nice and white. Now, speaking about white teeth, we are still staying with our dentist, Dr. Idelle Brandt. But first, we're going to go to our commercial break and we'll talk to you soon.
You're listening to the Talking Alternative Network.
Are you stuck in your business or career? Trying to take your business to the next level and it keeps hitting a wall? This is Sam Leibowitz, the Conscious Consultant. I will help you get to the root cause of your abundance issues and help move you forward in your life. Call me now and let's create the future you dream of. 212-721-8183. That's 212-721-8183. The Conscious Consultant, helping conscious people be better business people.
Have you ever considered consulting a roadmap when you feel you need help getting to your destination? When the normal path seems blocked, a little help can come in handy when choosing an alternate route. Your natal chart is a map of your potentials. It addresses relationships, finance, business, health, and above all, creativity. Current planetary cycles can either support or challenge your objectives. I'm Montgomery Taylor. If you would like to explore the help of a private astrological reading, please contact me at monty@montytaylor.com. That's Monty, M-O-N-T-Y, @montytaylor.com.
Talking Alternative Radio, 24 hours a day.
Welcome back to Dynamo Lunch Radio. Time is flying with all this information coming out from Dr. Idelle Brandt's mouth. After all, we are talking about the mouth and dentistry. Now, speaking about dentistry, it also always includes heavy metals, and we have discussed a few. We've discussed also root canals and the thyroid, which, of course, if you think about it, is close to your mouth, as is your brain, is close to your mouth area. So toxins can migrate either way very quickly. Now, another major toxin that we have in our environment is called BPA. Dr. Idelle Brandt, what would you like to tell us about that?
Okay, BPA or bisphenol A has been in the news a lot lately. Basically, it's a plastic, and what it does is it acts as a xenoestrogen. And a xenoestrogen, xeno meaning foreign, and estrogen meaning estrogen, the hormone. And the problem with most people in our culture is that we have way too much estrogen already in our diet. We're getting it from the hormones in the meat, the pesticides, in the foods. It's in the plastics in the bottles that you're using to drink your water from. It's in everything. And you know, goodness help you if you're microwaving your food in plastic containers, the BPA is just leaching out so much, even more so. So the reason why you mention BPA is it is in some dental materials, especially in the white fillings. And we want people to be aware that when they take out these toxic silver mercury amalgam fillings, you do not want to replace them with some toxic high BPA white fillings. So when you go to your dentist, you, besides making sure they follow safety protocol when they remove these mercury fillings, you want to make sure they're replacing it with something that is safe for you and not creating more of a hormone problem for you and creating further illness.
Well, that is terrific information. And the thing is, I know, Dr. Idelle Brandt, that you are among a group of very esteemed mercury removal dentists. So congratulations on that.
Thank you. Yes, I just got accredited with the International Academy of Oral and Medical Toxicology. It's an international group that trains and educates dentists and other holistic practitioners. And I was just accredited with them for practicing safe protocol in mercury removal. It involved taking a long exam and also doing a clinical case presentation.
Well, so if you'd like more information regarding Dr. Idelle Brandt or also information on the topics, you are welcome to contact her. She's got a terrific blog with great information you can use. And you're always welcome to contact me at nyintegratedhealth.com. I do try to update my blog, and the show will be in the archives this afternoon and on my blog tonight. So do listen in and do share this, because this is very important information and it's very helpful information for all ages today. And now, speaking about toxins, I know that we have discussed the metals. We just spoke about the xenoestrogens. In your practice, you also have a focus on detoxification. And that ties in with the fact, with your nutritional training, with your whole background and your personal history, health history, and your own experiences. Now, how do you do detox in your practice?
Okay, we have many aspects of detoxification in the office. One of the things that we offer our patients in the office is something called an ionizing detoxing foot bath, where basically you have your feet sitting in a foot bath for about a half an hour, and it has a special ionizer in the bath with it. And as you know, the soles of your feet are connected with all the organs of your body. And from reflexology, we all know that. And what happens is the ionizer opens up the soles of the feet through the meridian system and detoxifies toxins, whether it's mercury or lymph tissue or lymph. Right, you know what I mean.
Yeah, exactly.
Yeah.
Yes.
So it's a lot of different ways it can detoxify. So that's one way we can do it. The other way that we offer detoxification is through homeopathic remedies. We do offer that in the office as well. We have that for patients who are interested in approaching it that way. We also suggest you do it through nutrition. Nutrition would be perhaps eating more cilantro in your diet, which helps pull out the heavy metals. You can even do things like eating dandelion leaves, because that's a good liver cleanser, and if your liver is working well, then certainly your body will detoxify better. A simple thing you can do at home as well would be something like a salt bath, just putting in a cup of Himalayan salt or sea salt into your tub and soaking there for about 20 minutes, and that would do tremendous things to help the body push out heavy metals and other toxins through the skin.
Yeah, because it's just so important to know that, yes, these metals can be a problem. And also, for instance, just as an example, I mean, mercury and candida, there's a strong link between those two. So when there are health issues going on, you listeners, you might want to consider to open your mouth, look in the mirror, and take a look and see what's going on there. And if you see that there are some fillings in there, you might want to consider that avenue if you are experiencing health challenges, because things can be hidden in the body, they move around, but you want to go to somebody who knows, and who knows the insides and out of how to take care of things and how to look for things as well. Regarding detoxification, metals are great, and the foot bath is terrific that you did. Cilantro and chlorella, any dark green vegetables are very helpful, because they really help to support the liver function. Kale and Brussels sprouts are in there as well. We call them the cruciferous vegetables, or the brassicas. So there are many things that you can do at home, and if you don't like to eat those vegetables, then I do suggest you might want to consider supplementation with that, so that your body still gets the nutrients that facilitate detoxification action. Should you be on medications, though, then please speak to a licensed practitioner about that. Now, Dr. Brandt, a question for you. Besides doing all your work and having all these interests, being a Reiki master, doing the tuning forks, energy clearing, you've also had time to write a book.
Yes. I've written 2 books within the last year. The first book I wrote with my daughter. She is an intuitive metaphysical healer. We wrote the book called Enlightened, Indigo Child, and it's a great book for anybody who's interested in having a healthier life. It talks about the physical detoxification that you should do to have that, as well as the emotional detoxification. And if you're interested in energy medicine, we do touch on that quite a bit, and her experiences and how you can work with that part of your health system to be a healthier person.
Oh, that's great. So the detoxification tips we spoke about are in that book?
Yes.
Okay.
Yes. And the other book, for those of us who are not interested in the energy medicine aspect, is called My Secrets to Regaining Health. And it talks a little bit about some of the challenges that I had with my own health, and how I was able to detoxify on a physical level to regain my health.
Mm-hmm. Because I know from our conversations that you certainly have quite a health history, and here you are sitting, and you just walked 4 miles to come up to our radio show.
I love New York City. It's a great city for walking.
Yeah, you're firing on all cylinders, so whatever you're doing is working. Now, regarding the second book, when did you write that book?
I wrote that book the week of Hurricane Sandy, because I had no patients in the office, but I did have electricity, and I like to keep busy. Mm-hmm. And that's what I did.
Right. So now, what is coming up on your agenda?
In the near future, I do have a Reiki class coming up in May. You can go to my website and get more information about that if anybody wants to learn how to work with the energy field for healing, which I feel is a really important aspect for gaining really a much better and healthier lifestyle.
Mm-hmm. Now, for anybody out there, no matter what age, who is considering to go into dentistry, what words of advice would you have?
Dentistry is a great field. Mm-hmm. You have to keep an open mind and keep learning, because what they teach you in dental school is certainly good, and it helps you to be a great dentist. You can even be a greater dentist by educating yourself with aspects that you can integrate into the dental field, such as nutrition and energy medicine and detoxing.
Mm-hmm. So for somebody who just wants to take better care of their teeth and their health, are there any specific books that come to your mind besides your own?
I really like. There's a book on epigenetics. I cannot think of the author, but Bruce Lipton, that's his name.
Bruce Lipton.
And he talks about how your environment will determine the play out of your DNA and how your health will be. He's a phenomenal genius guy, and I have to say he's given me a tremendous amount of insight into health and healing.
Right. One of his books, The Biology of Belief.
Yes.
Right?
Yes.
Indeed. And for myself, with great pictures for educational or reference purposes, I always like Wesley Price, his book, the book called Nutrition and Physical Degeneration. So that's a wonderful book to read. And if you'd like some more information, you're always welcome to connect with me on my website regarding other books. And of course, you can always connect with Dr. Idelle Brandt on her blog and website. Now, listeners, it has been tremendous to be on the show today. And again, it's always such a delight to be able to share information with you. And I'm so thankful that my guests are coming into the studio to talk with me and to share information that I didn't know myself. So, Dr. Brandt, I thank you very much.
Thank you, Rika.
And we got to take care of our teeth, because we only have, in our later life, we only have one set of teeth. And we want to hold on to whatever belongs to us in the first place. Thank you very much.
Thank you.
Bye-bye.
You're listening to the Talking Alternative Network.
Hi, I'm Dana.
And I'm Don.
We are certified mediators, and I am a family and couples licensed therapist and author of Please Don't Buy Me Ice Cream.
Our show, New Beginnings, is about helping you and your family recover financially and emotionally and start the beginning of your life.
We'll answer your questions on divorce, family court, co-parenting, personal development, new relationships, blending families, and more.
Dana and I will bring you to a place of empowerment and belief that even though marriages may end, families are forever.
Join us every Monday starting September 10th at 10 a.m. on TalkingAlternative.com.
Are you suffering from aches and pains? Has traditional medicine let you down? Are you tired of taking toxic medications? Then come to the Double Diamond Wellness Center and learn how our natural methods can help you to heal. Call us now at 212-721-8183. That's 212-721-8183. Or find us on the web at www.doublediamondwellness.com. We look forward to serving you.
You're listening to the Talking Alternative Network at www.talkingalternative.com. Now, broadcasting 24 hours a day. Talking Alternative.
This is Tony Martignetti, the aptly named host of Tony Martignetti Nonprofit Radio. Big nonprofit ideas for the other 95%. Technology, fundraising, compliance, social media. Small and medium nonprofits have needs in all these areas. My guests are expert in all these areas and more. Tony Martignetti Nonprofit Radio. Fridays, 1 to 2 Eastern on Talking Alternative Broadcasting.
Are you fed up with talking points rhetoric? Everywhere you turn, it's left or right spin, ideology, no reality. In fact, it's ideology over intellect. No more. It's time for the truth. Join me, Larry Sharp, a.k.a. The Neo Sage, Tuesday nights, 9 to 11 Eastern, for the Ivory Tower radio program. In the Ivory Tower, we'll discuss what's important to you, society, politics, business, and family. It's provocative talk for the realist and the skeptic who want to know what's really going on, what does it mean, and what can be done about it. So gain special access to the Ivory Tower and listen to me, Larry Sharp, your Neo Sage, Tuesday nights, 9 to 11 New York time. Go to ivorytowerradio.com for details. That's ivorytowerradio.com. The Ivory Tower is a great place to visit for both entertainment and education. Listen in, Tuesday nights, 9 to 11. It will make you smarter.
TalkingAlternative.com